Welcome to the Surgeons in 3D Printing podcast. And today, after a very long time, I have a guest which is very special and close to my heart, Dr. Jayanthi Parthasarthy. And today, I want to celebrate this day because we are going to launch our book, which is Fundamentals of Medical 3D Printing for Medical and Dental Professionals. Welcome, ma'am. Welcome back to the podcast.
Thank you, Ruchi. It's been an amazing journey with you. Last few months, we have been working together on this book, and it's been really an amazing journey. Thank you for the opportunity.
Thank you, ma'am. It was really inspiring. You were very inspiring, and not only inspiring, but rather I too learned a lot from you. And I think today, before we actually disclose that, yes, this is the book that we have to launch, and it is already there now, available on Amazon, let's discuss particular things which went on behind the scenes. So let's start with our backgrounds. So could you tell the viewers and the listeners about your background and important landmarks in your professional journey up until now, so that we get a perspective of why we then went for the book? So, yeah.
Absolutely. This is a very interesting question, and I'm sure people should be interested in seeing why these two people got together and wrote the book. My journey into 3D printing happened about, I should say, close to 22 years ago. I'm amazed it's going to be close to a quarter century. Wow. I can't even believe so. It's been really so. So I actually started the first computerized diagnostic center for maxillofacial discrepancies way back in '87, and started writing my own programs on CAD/CAM. Like we always say, necessity is the mother of invention. Since people refused to teach us, then we started learning things on our own and writing the program. And there's always somebody who lands with you at the right time to do the job. So we did it. And in '97, '98, I was translating my program to Windows. And when I went to the engineering university to help me with that, they said they were getting a 3D printer. Anna University got a 3D printer then. And I was really surprised when they said, we are getting a 3D printer, come on tomorrow. I said, what's a 3D printer? All I knew was paper and printing.
Right.
The next day was really a game changer for me. The moment I saw this, it wasn't a huge big machine. It was a Dimension 50, and that was, it was more than a desktop, but less than a huge monster what we use, some of these things what we use today. And it started printing a mandible. Wow. Yeah, I was really amazed at that, I said, because they had the STL file then supplied by the company. Wow. And we printed that at the first stop. It was really a game changer. I said, my heart went into it, and I said, I got to get into this technology. And because I was a maxillofacial surgeon at that time at Malad hospitals, and when we used to do the reconstruction after tumor resections, they used to come back after 3 months to give them a denture or whatever possible to replace the teeth. We had no other options, excepting the reconstruction plate what we used, and the fibula grafts were all few and far between, and many people were not even talking about it, and no question of any implant. Then I said, here's the technology, and we started doing that. Then at the end of that, I said, okay, we have played around with these plastics. Now it's time for me to look into implantables. Then went and did my PhD in at the University of Oklahoma with Dr. Shivakumar Raman, where I worked on 3D printing of titanium. I worked on lattice structures because I quickly realized the density and the Young's modulus of titanium was way too much to put in, which is going to cause stress shielding. So we started working on that, and very interestingly, the first part of the paper got the De Corbin Award from the Society of Manufacturing Engineers, and that was the first ever recognition in my this one. So then I worked in the industry for 6 years at Dallas, Texas, where I was the director of the company. Gave them the directions right from scratch. It was a startup, and then we came further along a long way in maxillofacial reconstruction. It was time for me to move on to the rest of the parts of the body, and I said a hospital would probably be the best. And now here I am at Nationwide Children's Hospital, heading the 3D printing program, and working all the way from the neurosurgeons to the orthopedics to the cardiac to you name the specialty, and we work with them, including the education and the simulation department. Very happy to do so. So it's been a really long journey, but it's been a very happy journey.
Wow, ma'am, it's a pleasure to listen to all this, and I'm sure people will be surprised that how you could jump from a clinical journey to a mechanical engineering journey
Exactly.
and then back to clinical work. And I mean, it's a mix of clinical and engineering at the
Right.
moment. But I think you were able to connect what you learned earlier. So it was like connecting the dots in your life and
Yes.
getting the right experience for the right things to do. I mean, in future.
Very true. It was the path was. I mean, everything happened as a natural corollary, one after the other. My initial CAD programming on 2D made me think on 3D after some time. Then to go from the design to with the physical parts, and then how. So the interestingly, even today, my surgeons are happy because I'm able to talk with them the language that they talk with the
Exactly.
surgeons, and also understand the
Engineering.
manufacturing aspect of it
Exactly.
and the materials aspect of it. As dentists, we learn a lot of materials on the way.
Yes,
So
definitely. It's a whole new subject for us. Like dental materials is
yeah.
one whole
So
subject.
the handle materials is a very vast one, and it's something which is going on, which
Even
is
now.
increasing every day.
Yes, it is.
So now that 3D printing is doing the same thing, so it's actually very connected, very connected.
Exactly. So, ma'am, I mean, I've heard all of these words from you time and again. And even when I listen it every time, it's very inspiring to know that, you began from the medicine world and you jumped into the engineering world. You could get all of it here and then you could implement it back to the medicine. It was like giving back in a way. And it's amazing. And I think you were a very apt person to be there for this book project, which I really, I mean, I feel that I was lucky that it is you. I mean, amazing. Because for me,
Actually, we were, I mean, blessed to be together, I would
yes,
say.
ma'am, definitely. And for me, it was like I still remember, ma'am, around 12 to 13 years before when we were doing our fellowship, not a fellowship exactly, but we were doing a training in the cancer hospital in Noida. And at that point in time, we had patients who required palatal reconstructions, and we gave them obturators. So when we gave these obturators, definitely there was a part of hard palate and the soft palate which had to be covered. Back then, we were not using 3D printing. But then we gave them the obturators. We tried best to really create them. But as we progressed, I realized that with technology, we could have given them far better ones. Similar situation happened when I
Right.
started working in maxillofacial trauma, where we had reconstruction defects which could not be handled in the acute setting. And they went for secondary reconstruction and they were in a bad state. So in my PhD, I did my PhD and I did the mid-phase reconstruction using medical 3D printing. And there I realized that there were a lot of things which we could not attain by a single surgery or even if it was two surgeries. And the results that we could obtain by using medical 3D printing were very fast, within less period of time, with lesser surgeries. And I think they were amazing. I mean, the outcomes were amazing. And so I went into the subject. I wanted to know where is the world in this because I thought maybe we are far behind, and definitely in certain instances we were. And so getting to know so many experts, I brought in people in the podcast, and these experts, I learned a lot from everybody, you being one of them. And today I'd also like to tell my guests that, ma'am, you are the pioneer actually who started with medical 3D printing in India, so as to say, because it's been a long time since you've been practicing this particular technology and bringing it to the world. So congratulations on that as well.
Thank you so much. Actually, we started with custom cranial implants way back in 2003 2004, where instead of printing the cranioplasty plates, we used to use the forming, but we used to print the skull and then make the design out of it.
Right.
And my first surgery was in Coimbatore at KMCH with Dr. Parthiban, and we were able to do two cranioplasties in under 2 hours in the
Wow.
same in the
Amazing.
same theater with the same team, same
Wow.
surgeons, same nurses, everything was same.
Yeah.
So we were able to finish the surgery within uh, under 40 minutes.
Wow.
And the implants fitted so well. And then we were able to clean the room get it ready for the next surgery, and f- finish it within about 2.5 hours.
Wow.
That was it was really a big thing when we first realized how quick the surgery can be, and we can take away the effect of intraoperative casting of PMMA during the cranial surgeries.
That's really amazing what 3D printing can do and the potential. So next, ma'am,
Absolutely.
before and now we can just jump into our journey. So I like you to start how we started with the journey of the book. I think our listeners will be interesting to really know how we really started. This was a new endeavor for the new year, so please
Yeah,
let's talk about that.
yeah. I would first say the first thing was sometime, I guess it was in late November or something like that. Uh, I received a call or an email from you which said, I would like to meet with you. And when I saw that mail, I said, who's this person talking about 3D printing? And I knew India was going far, far forward with 3D printing. But when I heard this name, something struck in me. I believe there is a connectivity between people and we come together for a reason. And
Definitely.
that connectivity is given by somebody from above. And so when I saw that, my inner heart told me, talk to this person immediately. So then I called. It was probably late in the night when I came back from work. And I was thinking it's going to be morning for this person. And so I called. Then she said, it's midnight for me. I felt so bad.
It
But
was, I think, 2:30 a.m.
yes, having disturbed you at that hour, because I was under the impression that it's going to be in
in
India,
India.
and hence I got the number I had was an India number. So I took the time difference and I said very comfortably, let me call this person kind of early in the morning. But of course, it was
No, ma'am, I'm lucky to get that
that
call. I
was
mean,
bad.
that is important.
Uh, but I was really very intrigued the way you spoke to me in the early in the morning at 2:30. The enthusiasm with which you spoke to me really struck me in it. It struck me hard. So then I said, okay, I have to work with this person,
Thank
and,
you.
and take things forward. And when we spoke to each other, I think we spoke about our journey, and we were able to relate to how we both have come from the same
Background.
base, and then but when we move forward, and now we are connected at, at a point. It's like the I mean, a parallel line starting on two sides and then getting connected. Then we had the first podcast. I was really very happy about it, and it was really so nice. And then in January, when we were wishing each other Happy New Year, we said uh, we need to start a new project, and we wanted to do it within a definitive timeline. And we realized the basic need of the quick um, book, which we said will be basically a reference for a starter who's going to um, have some insight into what the technology holds both on the medical side as well as on the equipment side and things like that under one roof.
Exactly.
Because you see all this information all over the place, but when somebody wants to really f- find something, then we said we'll keep our timeline as under 3 months. It was a hard target to achieve, but we made it.
Yes, we did make it.
Yes.
Almost there. Like maybe a month's delay or something like that, but I think that's okay. I mean, with
Yeah,
whatever
but
the
only if you
circumstances
keep
were.
3 months. Yes. Only if you keep 3 months, you'll be able to do it within four
Yeah,
months. Because
exactly.
if we say four, definitely all said and done, the first month goes in
Just
other
planning.
priorities, and
Yes.
only when your target days come
Nearer.
you start looking, you oh my gosh, I got to do
Oh,
this
yes.
as I start doing
That's
that.
what happened.
Yes, that's
Exactly.
very true.
Yeah. And I think, ma'am, in our journey, we had those common gaps that we found difficult to kind of fulfill. Like for
Right.
me, it was like I saw that being coming from the side of medical fraternity, I realized that we could not understand the engineering language, and we could not understand their books in their terms, and we could not relate to what it has to mean to the patient, and why should I adopt technology, and why should this be done. So that's the gap I felt, that if this could be really made simpler for a doctor to understand, for a dentist, for a medical professional to understand, maybe that brings you like a fundamental knowledge about all of that stuff in one place, and then I think you can quick start with your journey right there, because there is a lot to
Exactly.
the
Yes.
subject, but then getting to the fundamentals, I think that can be done pretty soon, but there is no concise book which can straight away take you to the fundamentals, and then you can dig further. I mean, there is no end,
Very,
sky is the limit.
very true. Very true. Yeah.
So yeah, so that was an interesting journey, and I think we made it in 4 months, so kudos.
I enjoyed every moment of it thoroughly.
Definitely, ma'am.
Couldn't have asked for a better partner to do something like this.
Definitely. Ma'am, I'd also like to know your views on why did you agree to write the book, and why did you feel that there was this right time and the need for the book?
Um, I've been toying with this idea for some time, saying that we need something, a consolidated starter kind of thing, because I saw a lot of people who wanted to jump into the technology, but the concept which they had was uh, you feed the images into a computer and there comes your model.
Right.
It's not that way. You have to understand uh, there are various steps that needs to go, the workflow that needs to happen, and also the technology that you want to choose. Even 3D printing has become too wide these days because
Yes.
there are so many manufacturing methods and so many machines and so many softwares out there. And having had this experience of going through from starting from India, where we did not have a program for 3D conversion of this one, where we wrote our own codes for that those days, is that now you have a lot of software, both approved and non-approved, and people don't understand the validity of the software and how the quality control needs to come. But eventually, when they find, say they print something for a cardiac and they say the VSD is too big. So the first impression for the cardiac surgeon is, oh, this technology is not giving me the right information. But it is
Right.
basically not the technology, it is the people who are working on the technology. They get to know what is needed and what needs to know. So when this came up, I said it will be a, a great value of what I have experienced to put it in words to the rest of the group, so that people need not reinvent the wheel again and again.
Right, which is very true, ma'am. Now, I don't think for the fundamentals we need to really reinvent the wheel. We definitely need to just go through the fundamentals and then actually work on the next
Yeah,
level of things which are needed. So,
yes.
what do you think, ma'am? Who will be benefited by this book? I mean, this is just a discussion so that our audience know what is the book about, and who are the people who would be exactly, who are those target audience we are looking for, who will really be benefited by the book.
Um, I would start like this. See, first I would say the today children are born with technology. So a student in the dental college knows the technology, knows any technology more than me, because I mean, so we came from days of no computers.
Right.
Today they are all born with iPhones, where they a 2 year kid can uh, find out his own program. So that the students will benefit it really to start with, because when they come out as surgeons, they have seen this. They would have uh, read a lot of journal articles, and they would have seen this, and they will be more open-minded to start using the technology with an open mind. So when they come out, they have no place to go to find everything under one roof, and uh, they they may or may not understand that. That is the first level. The second level, I would say, is the surgeons themselves. The surgeons themselves are a very hard nut to crack, because as long as I've been a surgeon, you've been a surgeon, but we have to accept this,
Yes.
because when you know something is working,
It's just working. We don't want to change it very soon.
yes, so you do not want to rock the boat with
Exactly.
anything new. So this will give them an idea how they can go one step forward to help the patient without rocking the boat. They
Exactly.
can continue to do what they do, but this will be an added value to them. So they will understand the value of it. And again, uh, the teachers in the simulation of cadavers are becoming a rarity these days. We still
Yes.
don't have enough cadavers. I remember when we were in the anatomy uh, theater, within a year we used to dissect two heads
Yes.
threadbare, starting from the skin all the way to the bone. But today it's not like that. So they are teachers are looking out for specimens, and there are so many rare diseases for which you are not going to get the data on, or
Exactly.
you're not going to have the specimens. So you can create all of that as a huge big library, and with the material that is coming out these days, the colors, the texture, everything like that, I
Possible.
think you can make an amazing library of the rarest of rare specimens, which will be one of the best things for the institutions to have. So even if institutions are going to start with that, that'll be really very helpful.
Right.
So with this, I think you have a gamut starting from the student to the teacher to the practitioner, almost everybody. Practically anybody who wants to start theory, who
Exactly.
wants to implement 3D printing, they don't even have to have the technology in their own offices. They
Right.
don't have, all they need to know is mm, what the technology can offer. This will be working for that.
Yeah, I totally agree with that, ma'am. I would like to add to this that off late I've had conversations with some engineers. One of them is mechanical engineer from Dundee, and there was another MBA student. She was also a mechanical engineer from Europe. And what I realized was these guys, they got in touch with me and they talked to me about what is the problem happening, why this technology is not spreading and penetrating to the doctors. So all the questions that they asked me were related to the fact that they wanted to know how to make it more simple for doctors. They could not understand the problems, because I think when you look at it as an engineer, you are not able to find that gap. And so I think for engineers to know the gap, when they would even just go through the book, they would actually realize that gap as well. So I mean,
Yes,
it goes for all kind of professionals and maybe even amateurs who just want to start with 3D printing over
exactly.
a period of time. So yeah, it's quite a short book, and uh, should be good for anyone to start with fundamentals basically.
Absolutely.
So now I'll ask you the next interesting question, which is, why did we go for Amazon publishing? Please reveal that. Why not a publisher? Why Amazon?
Okay.
Because we discussed this quite a lot. I mean, right from the
Oh yes,
beginning, we discussed this.
absolutely. Yeah.
Yeah.
Yeah. Sure. Um, we the and we wanted to publish the book. We saw we had two different processes or pathways which we could take. One is the regular one, go through the publisher, and then the other one is publish it yourself through Amazon. So we were looking at the time factor for the first thing, and this was our first book. So we wanted to make sure that it comes out on time, and because this is the right time for people, because there's a lot of push for people to do 3D printing in the medical arena, especially with the COVID coming in. People have been printing PPEs, people have been doing so many
So
things.
much.
So we thought this should be interesting. Uh, we believed when we went to a publisher, which we'll be probably doing for our next book, which
Next.
is going to be a traditional one. There you have to find the right publisher, and then you have to. It's going to take time for him to go through your proposal and then go through the hierarchy from the person who takes it and all through the way to the editor, and then come back, and it's going to be a back and forth at least two or three times in the minimum, and
Exactly.
which will eat up all our time.
Right.
So and we wanted to gain also first time experience of being a publisher ourselves, apart
Exactly.
from writing the book.
Exactly. And I
It's
think,
like do it all
yeah.
together.
Yeah. And I think we also had this intent in mind that being the first book and being the fundamental book, we wanted it to get out as soon as possible to the market, to get the comments, to get the reviews so that we can actually prepare for the next one. And I think with the publisher, there are a lot of stakeholders besides the authors. And so what happens is that it takes quite a lot of time, more than 6 months at times. So that is what we try to prevent
Exactly.
you going with Amazon publishing. So
Very true.
yes. And next one is a really interesting question, and which is how did we choose people for the forward? Because that was something we discussed on back and forth. Who
Yes,
should they be, their streams and stuff. So please talk about that, ma'am.
sure. Um, we both were that went through the after getting the book to a certain level, we thought, okay, this is going to be up, and we need to look into who's going to write the forward. We suggested to each other saying that this technology, this application in the medical world has two halves. It is basically the design phase and the manufacturing phase, and it starts all the way from uh, image data acquisition, and then image processing, and then goes. So the the initial the case selection is one of the most
Very
important.
important.
So we thought a clinician would be the best person to give the forward as far as um, the clinical applications go, and the design and the manufacturing is a completely different aspect of, or a different perspective of the whole project. So so we chose for the surgeon, we chose Dr. Sushma, who was uh,
My mentor.
Ruchi's mentor, and we are really very thankful for Madam to have written a wonderful forward for that. And the other half of the this one was the design and the manufacturing. I I could find no other person other than Dr. Gauri, who's the vice chancellor of the Tamil Nadu University, or the University of Madras. He was the first person. Though I started doing 3D printing in '98, in 2003 was when I I went and met Dr. Professor Gauri and told him, "Sir, I need to get to know more about this technology." And he said, "Come under my wings. I can take you for a master's."
Wow.
He had the belief that I could do,
Right.
and he had the trust, And he taught, today if I'm doing this amount of 3D printing, and you call me a pioneer, and I mean, people say so many things. Even though I can say that it was a walkthrough, he was the one who had the belief to take me into the engineering world. And
Right.
in fact, he designed a curriculum where any other medical student could come and join into the manufacturing engineering. It was so, and he is. There's nobody else whom I could think of. And
Exactly.
he wrote a very nice forward, and he went through the book in total, and chapter by chapter he gave what comes after that, um, uh, how the sequence goes. That's
Right.
really
No,
true.
ma'am, we are really, really very thankful for Professor Gauri and Professor Sushma, ma'am, to really give us those forwards, because both had different view of the technology, and both were actually complementary in terms of one being a surgeon and the other one
Exactly.
being an engineer. So it was like giving their feedbacks. And for me, with Dr. Sushma, I have been working for the past 5 years, not only 5 years, but I think even more, almost 8 years now, 7 to 8 years since my training period. So ma'am has been always very, very encouraging, especially the space that she gives you to kind of develop yourself and to learn newer things. And there are very few mentors who give you that space to really work, and I found that space with her, and she trusts me so much so that I can do this particular thing. And she's always collaborative and encouraging. I mean, I'm so lucky to be under her, for that matter. And so, I mean, getting a forward from her, for me, was really a blessing. And that's it. Yeah. And so that was an
It's an
interesting
honor for
journey.
us that
Yes,
both are
definitely,
together
ma'am.
for it. Definitely an honor.
Definitely. And after the foreword, ma'am, now I would like to come to the book exactly. And I would like to ask you to reveal about the organization of the book, the way we've actually written it, so that people can actually kind of understand how it goes.
Okay. Uh, the organization of the book is, this is the most important part. First, we started with what is 3D printing and gave an introduction. And then we went on to talk about a little bit about the history, how it all started, and how it slowly penetrated the medical world. The first 3D printing model I saw was in 95 at the International Co- Conference for Radiologists and Surgeons. And so at that time, it has just started penetrating. So that then we looked into the history a little bit. And then we saw like what are the various applications and what are an introduction of the technologies. Then we went into the processing itself, because the biggest thing about 3D printing is, apart from doing uh, the um, the regular off the shelf thing, the uniqueness is what you can make patient specific devices, patient specific surgical plans, and patient specific implant. So that these things happen from the patient imaging. So we took the workflow as the next, after we spoke about all that. And then we split the workflow into different aspects like imaging, then the post processing of the images, creating a file, virtual surgical planning, then after all the end result or the mesh file, that can be used for the 3D printing itself. And then from there we moved on to the different printing technologies. In between, during the processing, we looked into all the softwares available, which was both on the
Okay.
approved and the uh, those that can be used for in a clinical setting for diagnostic purposes, and those that can be used for research. And then we work, once we got the printable file, we started describing the technologies. There are hundreds of printers available today. How somebody is going to choose a printer?
That's a
And
big question.
it, it starts all the way from $200 all the way to $1 million. So that's a very vast range. So there's no point in somebody buying something what is not going to be useful for them. So we gave them an introduction to each of the technologies a bit more in detail, and so that they can have an idea uh, which printer will be really most useful for them, depending on the work. So before you start your printing job, you have to do a research to see what is the type of work you're going to be, where are you going to be concentrating, what's the type of materials that we'll need, what's going to be the end user needs. So they could analyze all of that with this book, and once they choose all that, they are ready, start, on your marks, get set, go.
Yes.
Their program.
Yes. And I would also like to add to this that I think it has a whole plethora. I mean, the whole workflow is there. And then with the workflow, we've kind of described each chapter as each step of the workflow. But we've kind of kept it summarized because we wanted to make it fundamental book, because we wanted
Right.
everybody to go the whole circle. And then maybe in the next project, we might describe that more in details. But for this one, we just wanted that somebody who reads the book can go full circle into the entire journey of how you can
Exactly.
get through.
Yes.
So, so ma'am, what are the plans that you have next with respect to a book? And no, not before. Before that, I'd like to ask you one more thing. What is it that you expect from people who really read the book? Because I think that is something we really need to tell people, because this is something which will
Exactly.
take us to the next step.
Sure. Sure. We've taken this as a fundamental book, as we said so many times in this talk, and we would like them to read the book and then give us a feedback as to where we they still have some questions and how we can answer them better. And those reviews are going to be implemented in the next version of the book, where we would add all those fields. So I think we would like people to read their genuine uh, reviews of the book, and we are not here to say everybody to say, oh, this book is so good, oh, the book
Exactly.
the book might be good. I mean, the book is good in our opinion, at least, but we would like to know this. We have written from our perspective of what we thought people should know. But if there are other questions, what somebody should would like to know, we would be very open-minded to put in all of what they say in the next
Definitely.
version, for sure.
Definitely, ma'am. I too feel that a real time feedback where people feel that there is something which is missing in the fundamental aspect and it should be there in the book. That is something we can add in the next probably version of the book. And all those reviews will be incorporated. And I think they should be, because the whole intent of writing the book is actually to help people actually get through the whole fundamental knowledge. And as you said, get, set, go. So then you
Right,
are like right on the patient and you know then where
right,
to start.
right.
Yeah, exactly. So with that, I'd like to ask you, what are your next plans with respect to writing a book, or is it over? Or are you done? I mean, it was a roller coaster for us. I mean, 2 3 months, and we were like doing our stuff, whatever it was, and then this was an additional thing where we were pushing each other to do things. So what
Yes.
next?
Yeah, this was interesting, definitely, and it was an eye opener for me to see, at least for me to see, because being the first book, it gave us a lot of thought process into what writing a book actually means.
Exactly.
Um, it's a, um, but I think it has also pushed me to thinking. We are given the basics, and especially having the knowledge of uh, so much of what we have done. So I think it's probably time we start writing book for different specialities, because I think each specialty has its own requirements and its needs, and what has to come into the book. So the next we'll probably will looking into other specialties, where we want to implement. One I want to write is definitely on pediatrics, which is a completely different field, and there are not many people or not many books on that. And I would like to, I'll probably include pediatric dentistry as part of one of the chapters, but pediatrics because the challenges in pediatric surgery is completely different from
Different.
adults. You have the problem of growth, you have the problem of anxious parents, you have the problem of compliance. There's a lot of things. So I think I would take some of that. And traumatology is again another thing. Cardiology is another thing. Orthopedics is a really vast field.
Wow,
So
subject.
like that, I would rather take, and oncology is another one. So that I mean, if you start talking about specialties, because since the technology is applicable to each and every
Each and every.
specialty individually, I think from our experience, we should be writing something on traumatology and pediatrics.
Yeah, perfect,
Two
ma'am. I
different
think
parts.
I go by what you said. And I think this time we plan to also have the experience of going the publisher way. So
Yes,
probably we would
exactly.
also approach, or we would like
Yes,
look out into the publisher's way and have that experience as well, because there was a lot of
yes,
learning with what we did this time. And I think those nuggets are there with us, and we would incorporate more of that in the next journey, and probably look out for even experts who could kind of write a chapter or give their view
exactly.
on
Yes,
different chapters to a book. So it would
yes,
involve more people, it would involve a publisher. So it's going to be a little more comprehensive with respect to what
yeah,
this was.
yes,
So exactly, ma'am. So
exactly.
this
Yeah,
yeah. So this basically completes the journey with respect to this particular book. But there is a lot more to be done, and yeah, and we have people who are already experts in different areas. So we will be incorporating a lot of other people
sure,
as well.
sure. Wonderful.
So this brings me to the end of this episode, and I highly recommend people to go for the book, read the book, give the real-time reviews. We don't need the cheesy ones, definitely. Of course, if you like it, then that's again a real-time review. But we don't need this just for the sake of it to say that it's good. But really, wherever you need, you can give your feedbacks, and we will truly incorporate all of that.
Absolutely true.
Thank you, ma'am, for coming in for the podcast and kind of getting together to have this release done. And this was an important thing that we had to do, and we had planned it quite back. But with the circumstances of the COVID happening and all of the other things happening with our families being affected in India, we had to delay
Absolutely.
this. But I think everything good or bad comes to an end. So thank you very much.
Thank you, Ruchi. It was really an amazing journey, and as I said, I enjoyed every single moment of it.
Thank you.
Look forward to working more.
Yes.